Hi guys, I'm Muriel. This is As Told by Muriel, and on today, this video is for the new graduate nurses who are embarking on this career. I'm giving you some tips on what to carry in your nursing bag. Yes, I know a lot of new graduates, particularly LPNs, when they get started, they either start in a long-term care facility, nursing home. Some go into the hospital setting, a few go into home health, and some even go into working in a doctor's office. But these are some tips of things you should carry in your nursing bag just to be prepared for some things that I still keep in my bag as a registered nurse who works primarily in long-term care. So let's get started. Okay guys, we know the number one thing that you should have in your bag at all times is a ink pen. Several ink pens to be exact. You will, even in this time of electronic charting, electronic Mars, you will always need an ink pen while you're working. You will always be writing something down. You will always, it's just standard. It's like a standard thing to have, and you'd be surprised how many nurses come to work without an ink pen. Now, mind you, I have been that nurse who has come to work without an ink pen, and before the day is even like started, I'm asking someone, do you have a pen? Do you have a pen? And it happens because, you know, you can sit a pen down, anyone to pick it up, and it's like you sit a pen down, anyone picks it up and claim it. I'm saying, do you have my pen? Is that my pen? And there's so many pens out here that look identical, and I've even had like 2 or 3 pens starting a shift, and before the end of the shift I can't even find, I can't find any of the pens. Okay, another thing that is good to have as a new graduate nurse or a nurse period in your work bag are highlighters. Yes, we use highlighters. We utilize highlighters a lot. One thing that I do, I use highlighters specifically for is on prescriptions. When the doctor writes a prescription for a narcotic, a benzo, any controlled substance, when the prescription is written and it's handed to me, I will fax it, but then I put a big yellow highlighted X over it. And I will even write on the prescription on the side, fax such and such date, such and such time. Or I will either write void on the prescription in a highlighter. This is done for one, to notify anyone who, we have those thieves out. We have thieves out there. I'm not gonna call them thieves. There have been cases where people have tried to take a prescription that was written for patients in long-term care facilities to a pharmacy and have them filled for their own personal use. So I started doing that years ago, and I know a lot of other nurses do it, where we put the highlight over it, because any tampering of a prescription, a pharmacy will not fill it. So like I said, I put a big yellow X in the highlighter, yellow highlighter, pink highlighter, whatever, after I fax it, and I'll put it in the patient's chart. Or there are a lot of companies a lot of homes that no longer utilize this chart. Prevent someone from picking up that prescription, taking it to a pharmacy, and getting it filled. Y'all will be surprised at how many times this has happened in a long-term care setting. Another important thing to have as a new grad nurse, I would say, is a little notebook, a little notepad. It can be one of those little small, I'll put a picture up here, or a big one. The little small ones are only like $1. But the reason I have that, and the reason it's good to have that, is because day to day, there are things that you will be told that you will need to remember, that you may have to write down. Like, you may get pulled aside and someone may tell you something, and then you forget all about it by the time you go sit down 30 minutes later. So I keep a little book, a little notebook. I've had several over the years, because y'all know I've been nursing forever. Over half my life now I've been a nurse. Yeah, half my life I've been a nurse. So I keep one, and say I do a blood sugar, I'll go and jot it down. If I do a blood pressure, I'll go and jot it down, like little things. Say I'm passing medication and an aide comes up and tells me, hey, so-and-so said, can you bring them a pain pill? Or so-and-so says, or so-and-so's daughter called, wants to know if you can call her back, or little things like that. Someone, social services comes and tell you something, therapy comes and tell you something. I'll be, passing medications, because people have no qualms. And this is another one of my pet peeves that I should have had in my pet peeve video. People can see you in the middle of a medication pass, and it doesn't matter. It doesn't even have to be an emergency. They will come and interrupt you throughout your whole medication pass to tell you little things that are really non-emergent. And I assume they're telling you this because they don't want to forget to tell you, but you see me pass the medication. So I keep a little notebook on the medication cart with me. So when someone comes down and tells me something to keep me from forgetting, I'll write it in the notebook. Or like if I said, like I did someone's blood sugar or whatever, I'll write it in the notebook, plus put it in the computer, because you'll be surprised. Sometimes you'll think you put something in the computer, but you actually didn't put it in there. And if you have it written on the notebook, then you can go in and you can say, oh yeah, okay, yeah, oh, the blood sugar was 115, or, something like that. And sometimes you'll forget, like even a regular blood sugar, to put things in the computer. So I always keep a little notebook or something on the cart, in my bag, basically in my bag. That's something good to have in your nursing bag. Another thing that's good to have is a blood pressure cuff, an automatic blood pressure monitor, not just the cuff, the entire monitor. I'm just going to include in that, I'm going to say it's good to have a blood pressure monitor, a pulse ox, a thermometer, a temporal thermometer, as well as pin light. Now I have recently started not having the pin lights because they break so often, and I just use my flashlight off my cell phone when I'm checking pupil reactivity. Put it in if you can, put it in a Ziploc bag, put your name on it. Make sure put your name on your equipment if possible, and have that with you in your nursing bag. It's a little better now, but over the years, I can't even count on all my fingers and toes how many facilities I have been to, and they do not have a working thermometer, blood pressure monitor. I mean, it's just ridiculous. And you would think with, the type of facility it is, that would just be common practice for everyone to have one. But occasionally places have it. They say those things are in the thousands of dollars. Places have them, but they get broken, they get stolen, just all kind of things just happen to it. And, I don't know why they feel it's just not necessary to buy. So I keep a blood pressure monitor. And y'all, let me give you a word of advice. I normally go I just go to CVS or Walgreens and I buy mine. I used to order them off Amazon, but I have learned that they break fairly, I'm not gonna say quickly, but they break fairly easily. Like I have yet to have one that has really last longer than maybe a year. For some reason they seem to break. I don't know why, but I keep my receipts, because if I've had some that break on me within 90 days. And these are not no cheap items, like my blood pressure monitors, because I like the ones with big cuffs. I don't like the wrist monitors, although a lot of people purchase the wrist monitors. I don't like the wrist monitors. I like the ones that can go around your brachial. And those tend to run anywhere from like $66 to $125, And so if one breaks on me within 60 days, it's going back and I'm getting another one. So that is another, I wouldn't say, once you may not be able to get it with that first paycheck, that second paycheck, but you will see by that first and second paycheck, you're going to wish you had one, because there are medications, a lot of medications, that you will need the blood pressure and the pulse before you can administer the medication. And to just have one right there on the cart, just readily available, is such a convenience before you have to go hunt one down, or have the aide give you one, or have to hold a medication because you gotta go run and run down a pulse ox or run down a blood pressure cuff or something like that. So I keep those things with me at all times in my nursing bag. Another thing to have in your nursing bag are some snacks. Yes, be so busy sometimes. I work day shift now. I hardly have time to eat lunch, although I'm going to take a lunch break. Don't get me wrong. There have maybe been 3 times total in my whole career that I didn't take a lunch break, but I hardly eat breakfast. And so you get it, say I'm getting up at 5 in the morning, I'm going straight to work, I'm getting into work at 7 in the morning. It's sometimes 3 o'clock in the afternoon before I'm able to take a lunch. So I've been up 10 hours and I haven't had anything to eat. That's where snacks come into play. I'll have in my bag sometimes cheese crackers or a bag of, I like cracklings. I eat cracklings. I'll have a bag of cracklings in there sometimes. Sometimes I'll have some pork skins. I'll have little candies in there sometimes. So it's always good to keep a little snack in your, a little fruit granola bar, something like that. Keep a little snack in your bag. Just in case, just to tide you over, because it's not always possible to take a lunch break 4 hours into your shift. Would be ideal 5 hours. So having that little snack, something you can eat real quick and get on about your day until you can actually take a break. Another thing I would say would be essential for us females to have in our bags are feminine products. I keep feminine products in my bag just in case. We know our cycles are supposed to be perfect. Sometimes they're not perfect. Sometimes you have little accidents. Sometimes you start to feel a little something in the middle of your shift and you're like, oh goodness, here we go. I still utilize maxi pads. I keep a couple in my bag at all times. Even if I don't need it, I have had coworkers who have needed to not borrow because they're not giving it back. I have had coworkers who have needed maxi pads, just all unexpectedly. And I always have at least 2 in my bag. So that's one thing I would say as a female. I would not necessarily as essential, but that is something that's good to keep in your bag. Deodorant. I keep a deodorant in my bag at all times. I'm just going to clump all these together because they're I keep deodorant, I keep a hairbrush. Sometimes I'll have like a travel toothpaste and a travel toothbrush in my bag. I say sometimes because I really haven't had that much now that we have to wear these masks. But I would always keep a toothbrush and a little toothpaste in my bag. Just because, y'all, working a 12-hour shift, sometimes, you eat lunch or whatever and you eat a little snack and, sometimes I want to brush my teeth. So I wouldn't say that is something essential. That's just something that I would keep in my bag. What else is something I keep in my bag? Now, I have had a coworker who did 16-hour shifts. And y'all, she would keep a fresh pair of underwear in her bag, Ziploc bag in her nursing bag, because she did 16-hour shifts and she said she just wanted to feel fresh the entire shift. So sometimes she would change her underwear during her 16-hour shift. Yeah, guys, so let me think. Is there anything else to keep in your bag? I think I just about covered it. Those are some of the things that I keep in my bag. Yeah, if you like this video, please hit that subscribe button. If you like this video, hit the like button, subscribe to my channel. This is Muriel. I am as Sold by Muriel, and will be right back at you with another video for some tips for the new nurses.